G'day, it's Chris from the Headache and Pain Management Centre, and yes, I am on the table. I'm taking the role of patient, and Deborah here is taking the role of physio today. And what we're doing is we're just showing you how we gently assess the neck and how we gently treat the neck for most headache and migraine conditions. So Deborah's going to go through, as I talk through, what we actually do, and you'll see that it's really gentle, really slow, and very good for anyone who's got sensitive necks or sensitive headaches and migraines. So what we'll do, hopefully you can hear the sound as I've got the microphone under the bed here. We'll see how this all plans out. So basically when we do start the initial assessment, what the physios will do is they'll see what the alignment's like with the neck, so the top of the neck, to see what is going on through there. So what Deborah's doing at the moment is she's having a bit of a feel through the top couple of joints of the neck, just to see what the alignment and the tightness of the joints and muscles are like. So what she's doing now is she's having a feel of what it feels like in the joint on my left hand side, and she'll go across and have a feel of what it feels like on the headache joint on the right hand side. And what we're looking to find if there's any sort of differences on one side to the other. Then what she's going to do is she's having a feel through the rest of the neck as well to see what that's like. And now she's having a feel of what is happening at C3. Now, the C2-3 joint is actually the most important joint for headache and migraine. It's a little tight there, Deb, I reckon. Does it feel tight to you?
It does.
Yeah, so I've actually got a bit of a headache today, so this is just a really good way for me to cheat some treatment out of Deborah. So what she's doing is she's feeling the joint from the back to the front, so she's putting pressure through her thumbs gently onto the joint to see what it feels like from there. Okay, so that is at C3. She's just held the pressure there so she can give me a bit of treatment while they're there as well. What Deborah will then do is have a feel of the joints a little bit lower down the neck as well, sort of on the left and right hand side, from kind of the C3 joint all the way down to C7 to T1. So you might have seen a video earlier in the week where I talked about how it's really important to find out if there's some stiffness through the joints below where the headaches are actually coming from, because it's really important for all of those joints to be moving really, really nice. So when we do all those exercises that we can do to strengthen the neck and to get the neck moving as best that it can, that you're giving your joints the best opportunity to actually move the best that they can from there. So Deborah's just had a feel through, and what'd you feel, Deb? What'd you find?
It's a lot tighter on the right side for you.
A lot tighter on the right, and I felt that too. So normally Deborah would ask, but I was too busy talking to you on the video. So at the moment, Deborah, what joint are you on there?
C2 on your right.
So Deborah's on my C2 on the right hand side. And what she's doing is she's doing some sustained pressure through that C2 vertebrae. So she's working on my C2-3 joint. Now, what's happening is she's holding that joint there. When she pushed on it, is that it reproduced a little bit, actually pretty firmly, the headache that I had. So what is happening is that that joint is referring pain into my head. And then what's happening is she's holding the pressure on there, and she's been on there for a good sort of 15, 20, 30 seconds now, is that the pressure under her thumbs is starting to reduce off. So as you can see, her thumb is not moving anywhere, but the joint is loosening up under her thumb. And at the same time as the joint is loosening up under the thumb, it's actually taking my headache away. So it started off at about a 6 or 7 out of 10, and I can tell you that, Deborah, honestly, and it's now down to about a half out of 10 as she's held it there. So what's happened is that the headache was reproduced, and as she held the pressure on there, it got better, gone. Now, if we're in doubt as to whether or not the neck is causing the headache to happen, that is actually how we diagnose and assess if a headache is coming from the neck. If it's able to be reproduced and then it's reducing all the way off under the thumb, then it tells us that the neck is the cause, which is really, really good. What's it feel like after you did that, Deborah? Does it feel looser after just doing that?
Yeah, it's a bit better.
Yeah, it is a bit better. You probably saw that on the video as well. It feels better to me too. Now, what Deborah's doing here, and this is for our lovely patients who will have seen us before, talking about emptying the cup. And this here is what's called a central PA on the C3 vertebrae. So Deborah is on what's called the spinous process of the vertebrae of C3. So it's the bumpy bit that you can feel. And she's putting a bit of pressure straight down onto that vertebrae. And what it does is it moves that C3 segment forward on that C2 segment, which is beautiful for headache and migraine. Jeff Maitland is the physio who first came across this technique back in the 80s actually, and it's one of the most beautiful techniques that you can do for treating anyone with headache of a neck origin or migraine from a neck origin. Is that getting better under your thumb there, Deborah?
It is.
Because it feels like that to me, so that's what it's like. So you can see there that she's not pushing really, really hard. She's not really trying to, put all of her weight through her thumbs. It's basically just how accurate you can be with the movement in the direction that it really wants to go. And after she's done that, I don't know if you can see it, but certainly to me, when she assesses the right side and the left once again at the end there, that was actually a lot looser and a lot freer as it's done, and it feels that way to me as well. I hope I haven't got a really big crescent on my head. But I hope that gives you a bit of an idea about how we assess and treat on day one. It's a really quite gentle process. It's really nice, and if it's too hard, too sore, too sensitive, it's really, really easy for our physios to let go of the pressure, and the pain's gone immediately after that. So it reduces the risk of flare-up. It gets a really good result when we do that, and that is just one of many, many things that we do here to assess and treat headache and migraine. Thanks a lot, Deborah, for your help. Thanks, Taylor, for the filming, and I hope that answers a few questions as to what we do here. We'll see you again next time. Cheers, and bye for now.